Hello everyone and welcome to the part second of memory-based recall questions for INICET May 2025. So satellism, that image-based question was there, is seen in, that is very simple, seen in Haemophilus. Kanagawa phenomenon, it is seen in which of the bacteria? So it is seen in Vibrio parahemolyticus. Helminth shows auto-infection. So which of the helminths which are shown, which shows the property of auto-infection, that is H. nana and strongyloids. Two of them are the correct answers. Which of the following is not a dimorphic fungi? So it is answer is Cryptococcus. It is not a dimorphic. Histoplasma and Coccidium is dimorphic. Patient with perianal pruritus and on Scotch tape test D-shaped eggs were seen. Image-based question, that was D-shaped eggs were given. So most commonly perianal pruritus, enterobias vermicularis is the answer for this. Now 28-year-old woman with painful lump in the breast, irregular and tender, with on core needle biopsy and no fever also. So on core needle biopsy, granulomatous inflammation was seen. So which of the following organism is affecting? That is Staph aureus, which will be the affecting organism. HIV patient with odynophagia and dysphagia and upper GI endoscopy showing white plaques in this esophagus. So which of the following will be that image will, like microscopic findings will be given. Microscopic findings were given. So which of the microscopic findings will be present? So yeast cells with pseudohyphae. This is the characteristic of Candida. So you have to know the organism, that in HIV or immunosuppressant patients, Candida will be seen and the microscopic findings will be yeast cell with pseudohyphae. Now most common, this is the most repetitive question, HPV serotype with cervical cancer. So 16 and 18, this is the most common. I think everyone has done it right. Now match the correct of following. So on lungs, it will spread epidemic typhus. Tick, it will spread Rocky Mountain fever. Mite, scrub typhus, and pox virus with molluscum. So these are the correct matches. Now on lung biopsy post-renal transplant, least useful stain will be, that was an image-based question. So on lung biopsy post-renal transplant, most commonly acute branching will be seen, that is significant of Aspergillus. And for Aspergillus, least commonly used is Congo red. Also Fontana is least commonly used, but Congo red is more least. So answer will be Congo red. Most common inherited bleeding disorder. So von Willebrand disease is the answer for this, clear one-liner. Most common in incorrect gene disease association. So for STK11 breast cancer, this is correct. P10 thyroid, correct. T53 for mucosal neuroma, this is wrong because P53 associated with MEN2. BRCA2, it is associated with prostate cancer, that is correct. Now female with adnexal mass and abdominal caking, this is a very important word, abdominal caking. So diagnosis will be, see, mucinous carcinoma of ovary. This will be the diagnosis, not serous, mucinous. Now caspase 1 involved in which type of programmed cell? That it is not involved in apoptosis, not in necrosis. So pyroptosis is the correct answer. Statement regarding thalidomide is incorrect. So it is treatment for multiple myeloma and type 2 lepra reactions. It is teratogenic also. It is not an anti-metabolite. So this is the wrong answer. Match the drugs. So categories were given H, R, X and G. So H will be insulin. Z, that is H is the like H kind that is available on prescription. So it will be insulin. Z is veterinary drugs. X is for morphine and G is for hepatitis vaccines. So vaccine, hepatitis V vaccine was given. So that is the correct match. Treatment of choice for complicated gonorrhea by penicillin resistant Neisseria gonorrhoeae. That so options were ceftriaxone, vancomycin, amoxicillin. But answer is for penicillin resistant ceftriaxone is the answer. Most common correct treatment for complicated UTI with septic shock. So with septic shock and complicated UTI, drug of choice is always meropenem, not amoxicillin or nitrofurantoin. Patient develop ataxia using carbamazepine and erythromycin. What is the cause? So ataxia is caused due to carbamazepine toxicity. Mechanism of action of phenoldiazepam. So it is a D1 receptor agonist which increase the GFR. This is not D2. Most of them have marked D2 also, but this is a D1 receptor agonist. Factors involved in calculating loading dose of a drug. So volume is needed, target plasma concentration and bioavailability. These are the factors. So answer these all, the option containing these like A, B and C, this was the correct answer. These are the correct factors. Sorry. Drug causing cholestasis without portal inflammation. So estrogen and androgens will cause cholestasis without any inflammation, not isoniazid, not amoxicillin. Uses of MgSO4 accept, this is very easy. So it is a neuroprotective, yes. This is decreasing eclampsia and preeclampsia, increasing the renal blood flow, yes. It is correct. Incorrect accept uses, this is not the use. This is not decreasing, this is increasing the incidence of abruption. Now drug interaction between diphenhydramine and imipramine, they both block muscarinic receptors. So this is the correct answer. Now drug used to reverse effect of varicocinium, this is neostigmine. This is the correct answer. Child with platelet count of less than 1000, bone marrow showing normal cellularity with increase in megakaryocytes. This is the scenario for ITP. So what will be the management? For management for ITP is IV immunoglobulins. Now this was an ophthalmic see baseline, both the pupil are in the center. When the patient is looking at left, so both the pupils are moving. When looking right, one of them is moving towards right, one is not. So diagnosis is intranuclear ophthalmoplasia and not third nerve palsy. Not a option for treatment for amblyopia. So video game is the newest modality for the treatment, and patching you all know. Strabismus surgery is also. Refraction is not a treatment, it is to find out. It is a investigation, not a treatment. Sensory supply to orbit, this is a simple question with trigeminal nerve. Other options for vagus nerve also, but answer is trigeminal nerve. Best defines blindness. So visual acuity, this is by WHO, that visual acuity less than 3/60 in a better eye after possible correction. After every possible correction also acuity is less than 3/60. It is called blindness. So in keratoplasty, storage medium for cornea and what sutures will be used. So MK medium is used and 10-0 nylon is used. So this is the correct answer. Now investigation used in to see individual layers of retina. So optical coherence tomography, this is used for this investigation is used to see individual layers of retina. Patient with decreased vision 2 weeks after cataract surgery. Signs are delayed onset endophthalmitis. Diagnosis and organism. So endophthalmitis will already told, and Propionibacterium acne will be the answer, not Staph aureus. Body weight before and after 6 months were noted in a PSC in a health register. So which test with PSM, this is from PSM. So if you are comparing anything before and after, always answer is paired T test. You are measuring the weight. So weight that will be the paired T test. Incorrectly matched. So standard error, yeah, it is correct. Variability, correlation coefficient, relationship, yes. Mean and medium, this is wrong, it is not dispersion. And movements were screwers, that is correct. Mean and median is central tendency, that is the correct. See, 10 children had past history of measles. 20 new cases this year. Total 100 children are in the village. So incidence is new cases and total minus previous cases, that is 90. So that will come 22.2%. That will be the correct answer. Most common transmission during pregnancy in the third trimester of pregnancy. So toxoplasmosis is the most common transmission. Now preterm baby, that is 36 weeks with shortness of breath, most common diagnosis. X-ray was also, chest X-ray was also given. So respiratory distress syndrome is the correct answer. 12-year-old SLE with nephrotic range proteinuria with viral loop lesions, drug of choice. See, and this will be the stage 4. So IV steroids with cyclophosphamide will be the correct answer. 6-week-old non-bilious projectile vomiting at the rate like at 3 weeks of age. Abdominal examination is normal. See, they have ruled out every abdominal diagnosis. That's why they have given it normal. So GERD is the most common answer, because the non-bilious. In obstruction and pyloric stenosis, that will be bilious. Now 3-year-old with history of cyanosis since infancy. So what is the component of TOF? So history is not important. They have directly asked the components of TOF. So answer is infundibular pulmonary stenosis. TGA is not the correct not the component. LVH and inter-ASD is not the component of TOF. Now mechanism of breast milk jaundice. So it is by inhibition of bilirubin conjugation in breast milk. This is the correct answer. Now 5-year-old with hepatosplenomegaly and cherry red spots in the retina, developmental regression is present. So enzyme deficiency. What enzyme deficiency? So you have to pick up the disease first, that is Niemann-Pick's disease, which is responsible for all these things. And sphingomyelinase, this previously they will ask directly which disease. Now they are asking the enzyme. So you have to understand the disease and the symptoms, then you will get the disease, then you will get the enzyme right. So sphingomyelinase will be the answer. Steps of pap smear, that is very simple. Some have marked per vaginal also, that was in the option, but that is incorrect. Per vaginal will be not be done, because we will not get any of the correct result if you use that. So per speculum, lithotomy per scapulum, and the sample will be taken. Correct timings for IUD insertion. This was a multiple correct question. Answer correct question. So after intermittent postpartum you can insert. Up to 48 hours of postpartum you can insert. 5 to 7 days of menstrual cycle you can insert. These 3 were the correct. Women with asymptomatic bacteria due to E. coli, most common complication if left untreated. So in the first trimester, I forgot to mention, the first trimester will be pyelonephritis, not low birth weight or anything, because in first trimester it will not affect that much. False about Turner syndrome. So this is a very easy question. Webbed neck is present, wide space nipple will be there, short fourth metatarsal will be there for sure. So prominent occiput is wrong answer, but the answer is this. Chromoperturbation, the image based question, it was given that free spill dye with infertility is there. So in diagnosis, what will be the bulky ovaries is there, that means bulky ovaries. So tubo-ovarian mass can be the answer. Does not cause bradycardia during labor. Which of the following things will not cause bradycardia during labor? So maternal fever, fetal head compression, abruptio placenta, and congenital heart block. These 3 will cause bradycardia except maternal fever. That is the answer. Child with cleft lip, picture was given, and which muscle will repair. So over the around the lip, what muscle is present? Orbicularis oris. That is a very simple question, I think. Incorrect about VAC. VAC is vacuum assisted closure. So redressing after 4 to 7 days, yes, we have to do. and increase proliferation and protein synthesis. Yes, it is correct. And continuous and intermittent, that is also correct. But pressure is, they have written -10, -20, that is wrong. Pressure is -125 mmHg. So thank you for staying. More parts can come, so stay tuned. I will try to complete the whole recall based questions, as many as possible. If you have any recall which you think I have left, you can comment below. Thank you.